Hello everyone. So this is going to be part 2 of my series of videos on tinnitus, which is the medical name for ringing in the ears. If you haven't seen part 1 yet, go back and watch that one and you'll get caught up to speed. So in this video I'm going to talk a little bit about what would happen if someone with tinnitus comes in to see me in the office. So obviously the first thing that will happen is I'll ask them questions about what's been happening with that. So when did this noise in their ear start? What does the noise sound like? Is it there constantly 24/7? Does it come and go? Is there anything that triggers the noise or makes it stop? So all of those questions we would ask about any symptom. At that point, what I'm really trying to judge with someone with tinnitus is I'm trying to put them into one of two categories. So the most common category is, the patients have this ringing in their ears or this noise in their ears, but it either doesn't bother them or it's a nuisance, but it's not driving them up the wall. And that's most people. That's probably 90% of people. Now, the other camp of about 10% of people are people who are really bothered by the tinnitus. It's making them so they can't sleep. They're getting stressed out, depressed, anxious, and they're basically going crazy from the noise in their ears. So that's kind of the 10%. Thankfully, it's not most people. So with the story I'm getting, I'm trying to put them into these two groups. I'm trying to find out more about the actual symptom itself. And then I'm asking them questions about any history of loud noise exposure in their past. And a lot of times people with tinnitus have either gone to lots of concerts, they've been gun enthusiasts and have been shooting guns, sometimes without earplugs, and it's very common in people who work around loud noise. So veterans, police officers, anyone who works in an industrial setting, it's very common to see this problem. So, once I've obtained all that history, at that point I'll do a quick exam, just to look in people's ears, clean out any wax, look at the eardrums, and obviously look in their nose and their mouth, which I do for every patient. So a really important thing that would then happen would be patients do need to get a hearing test to evaluate their baseline hearing. And most of the time with patients with tinnitus, we do see that patient has some level of underlying hearing loss. And it may be a small amount. It may be in only one or two of the very high pitches, but that little bit of hearing loss is enough for your brain to notice. And when our brains notice hearing loss, it's very common for our brain to try and fill in that hearing loss gap with a phantom sound, which is where the tinnitus comes from. So that's kind of the main workup or evaluation that I would do for a patient with tinnitus. Occasionally we need to order x-rays or CT scans or MRIs or things like that, but I'd say that's less common for this problem than some other things. So at this point, here's what we do for someone with tinnitus when they come into the office. And in the next video, I'll talk more about what we do to help treat and to lessen the impact of the tinnitus on the patient. So I'll look forward to seeing you there in the next video.